Hello friends, welcome to our YouTube channel on reversal of autism. So friend, in my previous videos I have spoken a lot on how to bring out the child out of the spectrum. So which means that we say that if your child develops eye contact 10 on 10, name response 10 on 10 and command following 10 on 10, and if he starts identifying objects, recognizing colors, and starts naming body parts, which means that we have now almost brought him out of the spectrum. But friends, when I said complete reversal of autism, the last part is remaining. And the last part and the most important part in reversing autism is the development of speech. So, friend, if we can develop the complete speech in a child, then I can label and say, yes, this child is now completely out of the spectrum and he has reversed his autism. So the final stage of development is development of speech, and in this video I am going to focus more on how the speech has to develop and what as a parent we have to observe while the speech is being developed. Friends, my aim here with this series of videos is to educate parents and to give them confidence that yes, autism can be reversed. Many of our colleagues say that autism cannot be reversed. But here I say that yes, autism can be reversed. And when you see the development of speech, you can see that there is a complete reversal of autism. So friend, in my last two videos, you must have seen where I have shown children and their parents with the testimonials where they are now seeing that the speech is being developed. So friend, here in this video I am going to concentrate more and going to educate you that when you see reversal of autism, what are the points which you should remember when we see the development of speech, and this is very important for you to understand and remember. So watch this video till the end where I'm going to take you step by step towards the complete development of speech. So friend, before we go further, we have to understand that in a normal child, in a normal reversal of autism, what are the steps of development of speech? So we see a child who starts babbling. He develops a one word speech where he identifies objects or most importantly identify the parent and say papa, mama, such one word sentences he speaks. As we see further treatment and as we see further improvement, then this one word gets converted into a two word speech like papa come, mama come, apple day, something like the two words are combined and he can communicate his desires. And as we go further, this two word speech develops into bigger sentences or 3-4 word sentences, and then he understands his surrounding and he starts expressing his desire, he starts expressing his emotion, and he can now communicate well with others. So this is a normal development of speech in a child where we see from babbling to one word to two word and then forming complete sentences. Along with this, we also see that the child is also intellectually improved of recognizing colors, objects, and in this way, slowly the child comes into the mainstream. But friends, now here we'll also observe that there are few aberrations, few variations in while we see the child gaining his speech, and these are important variations to be observed, and this variation also has to come to normal if we talk of complete reversal of autism. So friends, what are these variations? So we have seen in my previous two videos where I have talked of this variation, and these variations are: A, there is an echolalia; B, there is an YouTube speech which has got foreign accent; C, there is a self-talking speech. The child talks to himself. So friend, these are little bit variations in the speech, and we have to understand why these variations are there and how we can see that this variation also has to go when we claim that autism is reversed. So in my further videos, I am going to talk on echolalia, on YouTube speech, and also self-talking. What are the reasons why this child are talking in this way, why these aberrations are there. And now you also understand that what is a normal mechanism of development of speech. So friend, when before we move further to understand the various aberrations in the development of speech, let us understand how does the brain processes this information and why there are aberrations. So friends, suppose a child is there and he hears a sound, he hears some instruction. Suppose I am calling this child, hello, come here. Now how this information is going into the brain and how this information is processed. So when a child hears a particular word, that word is goes into the brain in an area in the brain which is called as the auditory cortex, which means in common language an area in the brain which recognizes this sound and converts into an electrical impulse for to pass on to further areas. From the auditory cortex, the impulse goes to a most important area in the brain which is called as the vernix area. And what happens in the vernix area? This sound is interpreted and this sound is understood. So we call this area as a area of comprehension of the sound, understanding of the sound, ki what this sound means. From here, this sound is then passed to the Broca's area where the sound is again interpreted, and then what responses has to be given, that response is articulated. So Broca's area is called as a area of reproduction of sound. From Broca's area, the sound then impulse as goes towards the cerebral cortex, the motor area, and from there the impulse is passed on to the vocal cord to produce the speech. So friends, understand this basic process of formation of sound, formation of speech. When somebody hears a sound, it goes into auditory cortex. Understand, it goes then into the vernix area, which is most important area for processing of the sound, understanding of the sound, and generation of a response. From that vernix area, it goes to the Broca's area where the response is being converted into the speech, which means what muscle, what things has to improve is converted, and then from there it passes on to the cerebral cortex to to the vocal cords for production of the speech. Now friend, one of the most vital point for here to understand is that the vernix area is very important where the speech is understood and reproduced. And if there is a problem of control of this vernix area which is seen in an autistic child, then the speech is not produced. So I'll explain how now the other aberrations of speech. So example, let us take now this example of echolalia. What do you mean by echolalia? Echolalia means the child is repeating the question and then answering. It is echoing. So which means that suppose I ask a child, what is your name? The child will repeat, what is your name? And then after that the child will answer, my name is ABC. So friend, now understand what is happening in the brain. In brain, the vernix area is not processing the information completely. So when the child is hearing this sound and the sound is going into the vernix area, the comprehension, the understanding of the question is not happening properly, and the information is then passed on to the Broca's area, and then the child, now because the comprehension is not there, the child will repeat the question first, what is your name, and then the processing has happened, and then he will repeat the answer. So this echolalia, where the child is repeating the question first and then answer, because the control of the brain is not there, and which is there, and because of this control which is not there, many of the symptoms in autism are expressed. We can see many symptoms of autism because this control of the brain is not there. So friend, here one of the most important point is that when we talk of speech therapy, the speech therapy is working on the production of the sound, which is in turn the reflection of the Broca's area. But the echolalia speech is not because of the problem in production of the sound, but because of the problem of comprehension of this sound and giving a proper response. So there is a little delay in the vernix area. So hence, friends, I suggest to every parent that speech therapy is very important when you want to develop speech of the child. But before that speech therapy is effective in your child, the brain has to get stimulated by homeopathic medicines, where the vernix area starts working properly, processing the information properly, and only when the vernix area will function properly, the child will respond. The child will not repeat the question and then answer. So this echolalia is going to come down only when the vernix area functions properly, when the vernix area processes the information properly, and that is going to be there through homeopathic medicines. So friend, this was in short about understanding the development of speech in the child, and in my next video I am going to take in detail about three main aberrations in the development of child, that is the echolalia, the YouTube speech, and the self-talking. Why these three things happen in the child and how to rectify those three things with homeopathic medicines, and how once we achieve improvement in these three areas, I can say that the child is completely reversed of autism. Friends, once again I repeat that the aim of this video is to make you parents understand, make you educate that what do you see. Many of the parents, when they are giving various treatment, they are taking various therapies, but they are getting confused because some things are improving, some things are not improving. The eye contact is improving, but the echolalia is there. The echolalia is improving, but the name response is not there. So friends, a very important thing is to have improvement in autism step by step, where everything has to improve and things has to be reversed completely. Only when we have a normal speech, as we have seen in my previous two videos, then only we can say yes, autism is reversed. I hope through this lengthy video and a little bit technical video, where I am talking of various areas of brain, I am able to make my point across that complete reversal of autism is possible with homeopathic medicine when you also see improvement at the level of speech. Thank you friends for watching this video. Thank you very much.